on this episode.
Because this goes in a kind of an end stage situation with the heart, the treatment alone could kill him. And right now, you can't see worms, which is a good thing. The first injection we have to watch because he can go into shock. So my day started off with crap because I woke up to having phone calls saying one of my doctor's car stranded on the road in San Diego. Lobby full of clients. Dr. Anderson texted me at 9 saying that she couldn't get in the shower, so she was going to break into her mother's house. Then she called the police. So we didn't have a doctor here till 10 o'clock. And then Dr. Luce was like, why am I the only doctor here? And I'm like, ah. It's been a crazy morning. Oh, Dr. Anderson doesn't have a shower at her house. She showers at her mother's house. I saw something in an x-ray that the other doctors didn't notice. Gee, do you think that heart looks like there's heartworm? And Dr. Anderson said, well done, Dr. Alex, which was shocking.
That's true.
And sure enough, we did a test and the dog had heartworm. And I was right. Now we can save the dog. I was just telling the cameras that I cannot legally diagnose. And so when I thought it looked like heartworm, Dr. Anderson legally made it valid.
I know.
Oh shit. It says we have to keep the dog for 2 days.
Why do we have to keep it for 2 days? Well, that's just a start. Let me keep looking at it. It's not the first time you've picked up something many doctors here have missed.
Did you hear that, baby?
I'm just saying. It's just the honest truth. I would never bother to kiss your eye. I'm a Ruff.
That's our surgery.
I just performed a surgery on a dog with bilateral inguinal hernias. It was a female dog. She was not spayed. Inguinal hernia is when the groin musculature and the tissues do not close around the circle that's normally present for the testicles to descend from. And so those holes can remain, and intra-abdominal structures like the bladder or the large intestine or the small intestine can go through the holes, get entrapped, twist, die, and cause death. So at any rate, it had gotten worse. It was quite large. The dog was only 8 pounds. I would say the size of the herniation on the left side was about the size of an apple. So for an 8-pound dog, very big, very firm. It had gotten larger suddenly, not really painful. The other side was a much smaller version of a similar problem. So usually when you go into those hernias to repair them, you stuff some intra-abdominal fat back into the abdomen. Maybe there's a loop of intestine, maybe the bladder is there, but generally it's pretty straightforward. You put it back in, sew that hole up, and you're done. This time it was not straightforward. The spleen had actually herniated through that hole quite some time ago. Twisted the blood supply off of part of the spleen, which is kind of a long organ. Think of it like a hot dog. So part of the hot dog went in, twisted the blood supply. That portion got very, very large. Could be cancerous, could just be that the blood flow backed up and we got a big, large portion of spleen there. Not only that, but when it herniated through, it pulled part of the uterus with it and the ovary. So all of those structures came through the abdomen into this tiny hole underneath the skin of this dog, which looked like the apple. Obviously, sooner is better than later. If this had gone unattended, even another day, this dog would have died.
The spleen was inside, and the ovaries and the uterus was inside. It was a bad surgery. I mean, long surgery. Oh, I don't know. I'm anticipating Monday. Yeah. Okay. All right. Okay. Bye bye. You're very welcome. Bye bye. this was the best Easter present ever. We have a doctor tonight.
Here for all your hard work for the last 2 years. $100.
It's a raise.
It's all your.
It's a raise. I thought this was for last night.
No, it would have been a lot less.
Bitch. Did you show him the tumor?
No, I don't want to see it.
Shh, lift it up. You want to get...
Oh.
So I've only been here for a couple of weeks, filling in, doing relief work, and some of the challenging surgeries are some of the hit by car dogs that come in where they have herniated intestines, you know, tears in their abdominal muscle wall, that sort of thing. There's been some challenging mass removals where the dog's tumors, skin tumors have gotten so big that there's a lot of times not enough skin to put back together again, so you have to do a lot of cosmetic reconstructive surgery to try to make the skin fit back together again after the tumor is removed. I went into the treatment area earlier today and there was a dog that had been presented just minutes prior and had been hit by a car. He was basically dead on arrival, and so the staff quickly put in an IV catheter so that we could get fluids administered and IV drugs administered. They placed an endotracheal tube so we could get oxygen to the dog. And then I started doing chest compressions to complete the CPR and try to get the chest going again. After about 30 minutes of attempts at resuscitating the dog, it was clear that he wasn't going to come back, and we called it, that he was dead and wasn't going to be coming back. And then on closer examination, we could see that he had, you know, bruising in the back part of his abdomen, probably blood in the abdomen. He had blood coming from the trach tube, so blood from the lung. So he had been hit pretty severely and was not revivable.
So, because this goes in a kind of an end stage situation with the heart, the treatment alone could kill him. Okay? So they want to keep him for the next probably 5 days, because the injection that we're going to give him, you need to know, could kill him. And right now, you can't see worms, which is a good thing, you know?
Yeah.
So we just gotta kill him, but we gotta kill him slow, or they cause heart attack and stuff. So the first injection we have to watch because he can go into shock. So he has to stay here for at least 2 to 3 days for that, okay? And so because he's already in a, you know, heart situation, Dr. Luce, who actually took the heartworm dog we knew about, she ended up adopting him. And so she was like, I would feel safe if Cisco stayed for about 5 days.
Is there any way I could see him?
Sure.
Okay.
I'm gonna put you in a room so you can hang out with him. Don't get him too excited.
Okay.
I need room 3 empty because they need to visit Cisco. Okay.
Really proud of you.
She's proud of me, people.
First time, won't be last, but
Thank you. I saw you roll your eyes just now. Thank you.
When what?
Just
when
now.
You just said the vet school?
When she said you should go to vet school and you rolled your eyes.
Because you won't do it. You can't do it. You can't sit there and have them treat you like shit like they treat you. You're not going to take it.
That's true.
So you don't know why I roll my eyes. Don't give me attitude right now. I don't need attitude this early in the morning.
Don't
Thank you.
cock your head like you're in the hood.
I'm in the hood. You taught me this. You brought this to me.
I brought the hood to you.
Well, you brought, yes. You brought
You taught me hood.
Oh my God.
You
Oh my
taught
God.
me
You're
hood.
not saying that, are you?
Yes, I just said it.
Oh my God.
Did you hear it? I said it. Thank you.
Oh my
You
God.
taught me hood. Oh, really? Really?
This is only because I don't have pink and blue. No, I don't have to know how to work this stuff. I didn't go to school for working x-rays. That's why you have people work for you.
How are you?
arrived. No playing with the other dog.
Okay.
Okay.
Should we isolate him completely?
For a while, yeah, because this was a very big surgery. Okay, so you know he's gonna still be in pain. Right now he's a little high. He's got a lot of pain medicine. See, these are the days that make this what's make my life happy. This is the perfect ending to a story. And the dog gets to go home.
So this is Max, and at first when we initially had the situation, we weren't sure what was wrong with him. He was just in a lot of pain. And when we brought him, we just thought, you know, they were going to run some tests on him, and it seemed pretty much that what they initially had told us it might have been cancer, and it had spread all over his body. So they pretty much gave him a low rate of survival. We just considered that maybe it was time to put him down because he was already in a lot of pain and he wasn't eating, he wasn't really moving, other than just drinking water. And we just saw a possibility to be very slim for him to survive. But once the doctor took a look at him, she thought that it'd probably be best to go in there and do an operation on him. And from what I understand, she's actually the one that donated and paid for the full operation of Max here. Once the operation was complete, it seems like it was all a success, and we're hoping for the best, and we're hoping that that he recovers really well. We know he's a strong dog and he's been through a lot, so we're sure he will be doing fine. It's just so happy and so grateful and so blessed that this even was able to happen. And there's a facility such as this, that we're able to bring our dog and make it happen.
They're gonna visit for a little while. I'll call you back. Oh, he's ready to go. Oh, dang it. Every time he gets out, he pees. Seriously, when we were doing x-rays, he peed. I need a cleanup in 3. It's just, hi, baby. I think they're gonna start the treatment either today or tomorrow, within the next 24 hours.
So the fact that you can't see the worms in the...
Is a good sign.
Okay, yes, that's what I was thinking.
Oh yeah, it's a very good sign. The problem, it's kind of like having fleas though. You have to remember that you kill the worms, but then the eggs, the larvae, so you have to continue. Yeah, and that's why it's a long process.
Okay. They're taking good care of you, huh, Boo-Boo?
How long have they had you?
Since Tuesday. Yeah. He's been coughing a lot.
Did you have him since you were a puppy?
Yeah. He's 13 now. He's an old guy. You're an old guy, huh, Boo-Boo?
You're doing something mean. You act like you're picking out bugs. Stop monkeying me. God. God, that's annoying.
I got bugs all over my hand. What? You didn't see what I was doing.
I knew you were monkeying me. I knew you were acting like you're eating bugs. I know what you were doing, but that makes you a monkey too. You're the monkey eating the bugs.
The cat back there is possibly blocked, and they come from the Humane Society. They don't have any money. They've already been turned away by another vet, and this is what's coming out.
Is somebody...
Right on the verge of being blocked. It's a male cat.
Is it unblocked? Is it not blocked?
He's...
Okay, give me the record. Let me write something down.
Vicky, can you give him the records? Give him the records.
No problem. They never gave me the weight on Cher. I got Sunny.
I need a weight on Cher.
Are we going to keep them or are they going to go? They look great. Are we going to keep them or are they going to go?
They're here.
That's all I need to know.
We're gonna wait for the piece of rock.
Okay, that's all I need to know. Thank you. So I want to set them up. Did I thank you?
Yeah, you did say.
I didn't intend to.
Oh, that's what I'm used to.
I did not intend to say thank you to you. If it was someone else, I would have said thank you, but not you. Oh my God. Oh my God. Anyway, okay. Are you behind me?
So the little dog that we removed part of the hip joint after it was hit by a car, that dog went really, really well. The tricky part with that surgery is, unlike other orthopedic surgeries where you fix a bone or something of that nature, and the dog needs to rest for a couple of weeks, for 6 weeks while the bone is healing. The important thing when you remove part of the hip joint is they have to go right back to activity, or else their muscles will get too weak. And we depend on those muscles to keep that leg functioning correctly. And so this little guy, 3 days later, was running around on that leg like nothing ever happened. No one can tell he doesn't have a hip joint there. He's probably a lot happier without it. And of course, his owners are just thrilled that we were able to do that surgery for him here.
We need to go to the corner and pick up 2 dogs. Yeah. Where's Martin? Oh. Martin!
Hi, Alex.
How are ya? What pretty.
Yeah, this is we don't know. Well, they're gonna give her names, I guess, but and they haven't eaten, and they're on Doxy.
Okay.
I guess that's what they said.
Come on. We're gonna go this way. Okay, Beverly, I need a chart for 2 dogs from Westside German Shepherds. They're from the high desert. I need PCRs. They don't have names yet.
Are they going to the back?
Yeah, they're gonna go in the back. Is that a male?
What are the names already?
I don't think. Okay, for now we'll use numbers. She's gonna bring you paperwork. But for now we're gonna call him Sunny and Cher, okay? The date. Okay. And then I need collars for that. ID collars. Okay. Come on, let's go see the doc. Rick, you're gonna go into your upper respiratory room. Can you do a PCR before they go back?
Duke's ready.
Did you see that backyard breeder, all her puppies? Her Barbara?
That's not a breeder. That's just a stupid person who won't bathe their dogs.
No, but she said that the dog catcher came to call her dogs.
Where'd you get it? She got it. From where? She's like a collector. A collector of dogs. Yeah, but she doesn't take care of it. Her dogs aren't vaccinated.
So there's a virus, and it's a really bad virus called parvo.
Walk outside.
And it can actually live for a year in like dirt and 7 years in cold environments. Highly contagious and very lethal. And it's kind of like, I define it as a puppy Ebola virus, because they pretty much bleed out. They start to bleed to death because their GI tract just starts to pretty much melt. You have a very short time once exposure is and symptoms start, and that's what you saw dripping was all the blood coming out of the dogs. And this particular woman waited while her other dogs died from the virus, and then now she's crying, of course, because she of course has no money. All of this can be avoided with vaccines, and so now she's already left 1 dog here that she doesn't want, and now she's bringing in more dogs that she doesn't want because they're sick.
All right, Alex wants to see you in room 3 about your rat.
Okay, $10. It's not about the rat. It's probably about that she wants me inside her, but I will go.
It'll be really fun to terrorize Abraham.
Okay.
No.
What?
Abraham's really scared of rodents.
I know, that's why we're doing this.
Abraham, I need you to come hold an animal while we clip the nails. Come on. Abraham's afraid of rats, and there's a rat in room 1.
Where?
Alex.
It's not the rat.
No, it's
No, it's the.
It's an animal. You're supposed to love animals. Come on, let's go.
But in any case, we'll do it tonight.
Come on, Abe.
Oh no!
Like I said, you better. Like I said, you better get a rat.
Hey, man, come on.
Somebody hold him down and I will put that rat right on his face. Hey, do that, do that.
Alex was very good with my Misha, and she even went as far as chasing some of her employees down with the rat who were afraid of rats, which I thought was fantastic. But most of all, Misha got what she needed done and some antibiotics for her little urinary tract infection, and we could not be happier. Show them your belly. Show them your belly.
I know.
She has the cutest belly, right?
Just go through one of those.